When we think of itchy eyes, we often attribute the sensation to common issues such as allergies, dry air, or even a speck of dust. It's a familiar annoyance that most people have experienced at some point. However, what if these persistent, unexplained bouts of itching in your eyes are trying to tell you something deeper? Imagine that your eyes are not just a mirror to the external world, but also reflect the internal workings of your body, particularly the liver. It may sound surprising, but there is an intricate connection between your eyes and liver health that many people overlook. In fact, persistent itchy eyes could be a warning sign that your liver is under stress or dysfunction, possibly indicating serious conditions like cirrhosis. The body's silent warning system. The human body is an intricate and complex system designed to send signals when something is wrong. While some signs are more obvious, such as chest pain signaling a heart attack or fever warning of infection, other symptoms, like itching, may fly under the radar. Itching is often seen as nothing more than a minor irritation that can be easily soothed with topical creams or lotions. However, when it becomes persistent and unrelenting, it could be the body's way of drawing attention to underlying health issues that you might not immediately recognize. In the case of itchy hands and feet, this sensation could be more than just an annoying skin condition. It could be a signal that something deeper, like diabetes or liver disease, is at play. Diabetes and its link to itchy hands and feet. One of the most common and significant health issues associated with persistent itching in the hands and feet is diabetes. This condition, which affects millions of people worldwide, often goes undiagnosed until symptoms become severe. High blood sugar levels, a hallmark of diabetes, can cause a cascade of reactions within the body that lead to persistent itching in the extremities, particularly the hands and feet. This may seem surprising at first, especially when considering diabetes is typically associated with symptoms like excessive thirst, frequent urination, and fatigue. However, itching can be a subtle sign that something is amiss. When blood sugar levels are consistently elevated, the body begins to experience a number of detrimental effects. One of the most common problems is dehydration. High blood sugar leads to an increased excretion of fluids through urination, which in turn can leave the skin dry and prone to irritation. This dry skin is one factor that contributes to itching. However, the problem doesn't stop there. Another key issue is poor circulation. Diabetes can reduce the flow of blood to the skin, especially in the hands and feet. This lack of circulation can further exacerbate the dryness and irritation, creating an environment where itching can persist indefinitely. But the problem goes even deeper. Over time, uncontrolled diabetes can lead to nerve damage, a condition known as diabetic neuropathy. When the nerves in the extremities are damaged, they send erratic signals to the brain, which can be interpreted as itching, burning, or tingling sensations. Even though the sensation might seem superficial, the reality is that it's a result of malfunctioning nerves, and it can be a sign that the condition has advanced. The dangers of ignoring itchy hands and feet in diabetes. The worst part of persistent itching in the hands and feet in diabetics is that it doesn't just remain a nuisance. It can lead to more serious health complications if left untreated. As the itching continues, many individuals begin to scratch at the affected areas in an attempt to find relief. However, frequent scratching can break the skin, leaving it vulnerable to infections. For someone with diabetes, the body's ability to heal wounds is significantly impaired. When the skin is damaged, it becomes much easier for infections to set in, leading to conditions like ulcers or even more severe complications that may require amputations in extreme cases. The relationship between diabetes and itching is complex, but it's important to remember that this sensation is not something that should be ignored. If you experience persistent itching in your hands and feet, especially if you have other symptoms like fatigue, blurred vision, or excessive thirst, it's crucial to seek medical attention immediately. Early intervention is key to managing diabetes and preventing the severe consequences associated with the condition. Biliary cirrhosis, a hidden liver disease. While diabetes is a well-known cause of itchy hands and feet, another often overlooked condition that can lead to this symptom is biliary cirrhosis. This liver disease is one of the most dangerous health conditions that people often dismiss or fail to recognize early on. Biliary cirrhosis occurs when the bile ducts in the liver become damaged, which leads to a buildup of bile. This, in turn, causes the liver to gradually deteriorate and lose its ability to function properly. While the condition itself may not initially present with noticeable symptoms, one of the earliest and most alarming signs is persistent itching in the palms of the hands and the soles of the feet. What's particularly frustrating about biliary cirrhosis is that the itching often intensifies at night, making it difficult for those affected to get restful sleep. The sensation can become so unbearable that it dominates daily life. People may initially mistake this itching for something as benign as dry skin or an allergy. However, when this symptom persists for weeks or even months, it's time to take a closer look at what might be happening inside the body. As the liver continues to be overwhelmed by bile buildup, the toxins that are typically processed and excreted by the liver begin to accumulate in the bloodstream. These toxins can eventually reach the delicate capillaries in the skin and eyes, triggering the itching sensation. In addition to itching, other symptoms of biliary cirrhosis may include fatigue, dark urine, dry eyes, and mouth. These signs, while seemingly disconnected, are all part of a larger issue with liver function, and they should not be overlooked. The critical importance of early diagnosis. When caught early, biliary cirrhosis can be managed through lifestyle changes, medications, and, in some cases, liver transplantation. However, if left unchecked, the disease can progress to complete liver failure, a life-threatening condition that requires immediate and intensive medical intervention. The itching in the hands and feet, as uncomfortable and annoying as it may seem, could be your body's way of telling you that the liver is struggling. And just as with diabetes, the earlier the condition is diagnosed, the better the chances of managing it and preventing more severe consequences. What should you do if you experience itchy hands and feet? So, what should you do if you experience itchy hands and feet that don't seem to go away? First and foremost, don't ignore it. Persistent itching is your body's way of signaling that something is wrong. If the itching is accompanied by other symptoms like fatigue, changes in your skin, or digestive issues, it's important to see a doctor. They can conduct tests to determine if your blood sugar levels are elevated, indicating diabetes, or if your liver is functioning properly. In either case, early diagnosis is critical. It's also essential to understand that itching in the hands and feet may not always be caused by diabetes or liver disease. Other underlying conditions like eczema, psoriasis, or allergic reactions can also lead to itching. However, if the itching persists and there's no obvious explanation, it's time to consult a healthcare professional. They can help determine whether your symptoms are linked to a more serious health condition. Listening to your body. A life-saving habit. Your body is constantly sending signals to communicate with you. Every sensation, from an itch to a headache, could be an important clue about your overall health. The key is learning to listen and respond to these signals rather than brushing them off as minor inconveniences. Persistent itching, particularly in the hands and feet, may seem harmless, but it could be the body's way of alerting you to serious health conditions like diabetes or liver disease. Taking a proactive approach to your health is essential. Don't wait for the symptoms to worsen or for other more serious issues to arise. If you're experiencing unexplained itching, take the time to seek medical advice and get the necessary tests done. Early detection and treatment can make all the difference in managing your health and ensuring a long, healthy life. The liver's role in detoxification and its impact on eye health. The liver is one of the most vital organs in the body. It works tirelessly to detoxify the blood, filter out harmful substances, and process bile, which is essential for digestion. When the liver is functioning optimally, it does this seamlessly and the body remains in balance. However, when the liver becomes compromised, whether due to overuse, disease, or environmental toxins, its ability to filter and cleanse the body diminishes. This can lead to a buildup of toxins in the bloodstream, a condition that is often silent in its early stages. The liver processes substances that are meant to be excreted or neutralized. These include waste products like bilirubin, a byproduct of the breakdown of red blood cells, and various toxins that enter the body through the food we eat, the air we breathe, and the water we drink. Under normal circumstances, the liver handles these substances efficiently, but when the liver becomes overwhelmed, these toxins begin to accumulate in the bloodstream, eventually reaching the capillaries in the eyes. The liver-eye connection. How toxins affect your eyes. The eyes, particularly the cornea and retina, are extremely sensitive to changes in the body's internal balance. When toxins and excess bile pigments build up in the blood, they can be deposited in the small blood vessels of the eyes. This can cause irritation and inflammation, triggering the familiar sensation of itching. It's important to recognize that when this happens, the irritation is not merely a symptom of an external issue like allergies or dry air. It is the body's subtle cry for help, signaling that the liver is struggling. Imagine your liver as a tireless worker who handles the body's waste management system. When this worker becomes overworked or inefficient, the body's natural detoxifying processes falter. This leads to a cascade of health issues, many of which manifest in seemingly minor symptoms like itchy eyes. The discomfort may begin as a slight irritation but can quickly become persistent and aggravating, signaling that something is wrong beneath the surface. What persistent itchy eyes really mean? If you've ever experienced persistent itchy eyes without a clear reason, such as dust, pollen, or environmental irritants, you may have brushed it off as nothing more than a passing inconvenience. It's easy to dismiss such symptoms in our fast-paced lives. However, recurring or unexplained itchy eyes could indicate that your liver is no longer functioning optimally. The liver, which is supposed to filter out toxins from the body, may be overwhelmed by the load it has to handle, and as a result, toxins begin to accumulate in the blood. These toxins can cause inflammation in various parts of the body, including the eyes. When the liver is struggling, the body begins to show distress in subtle ways, and one of the first places to manifest this distress is the eyes. What may initially appear to be a minor irritation could be your body's early warning sign that a much larger issue is at play. The persistent itch you feel in your eyes is a signal from your body, urging you to pay attention and address the root cause before it escalates into a more severe health problem. Liver dysfunction and the buildup of toxins. The liver's inability to process toxins effectively can result in a wide range of symptoms beyond itchy eyes. As toxins accumulate in the bloodstream, they can lead to various systemic effects, including fatigue, dark urine, jaundice, yellowing of the skin and eyes, and abdominal pain. The itching that starts in your eyes could be the first of many signs that your liver is not performing its crucial detoxifying functions properly. When the liver becomes overloaded, its efficiency is compromised, leading to a buildup of waste products that should have been filtered out. These toxins circulate throughout the body and can settle in sensitive areas, such as the eyes. The eyes, being highly vascular and delicate, are often one of the first places to show signs of this toxic overload. The itching sensation is not just a cosmetic issue. It's a red flag that your body is struggling to process and eliminate waste as it should. The body's subtle signals. A warning. You can't afford to ignore your liver is not always going to send you loud, obvious signals that something is wrong. Instead, it tends to communicate through more subtle signs that, if ignored, can progress into much more severe health problems. Just as itchy eyes can be a sign of liver distress, other symptoms like excessive fatigue, unexplained weight loss, and darkening of the urine can indicate that your liver is under strain. These subtle changes are often overlooked or dismissed as part of everyday life, but when combined, they may paint a picture of liver dysfunction. It is easy to assume that itchy eyes are merely the result of a change in weather, seasonal allergies, or too much screen time. However, when these symptoms persist, it's essential to dig deeper and consider the possibility of liver involvement. If left unchecked, the toxins building up in the blood can lead to more serious conditions, such as liver disease or cirrhosis. Ignoring these early signs could lead to irreversible damage, affecting not just the liver, but other organs and systems in the body as well. The ancient wisdom of traditional Chinese medicine: the liver opens into the eyes. Traditional Chinese medicine, TCM, offers valuable insight into the connection between the liver and the eyes. According to TCM, the liver is considered the organ that opens into the eyes, meaning that the health of the liver directly influences the condition of the eyes. In TCM, the liver is believed to be responsible for ensuring the smooth flow of qi, energy, throughout the body, and when the liver becomes stagnant or imbalanced, it can lead to a variety of symptoms, including eye issues. This ancient saying, "the liver opens into the eyes," encapsulates the profound understanding of the liver-eye connection. TCM practitioners have long recognized that the eyes are a reflection of the liver's health. When the liver is in distress, the body's internal harmony is disrupted, and the eyes become one of the first places to show visible symptoms. Itching in the eyes, along with other symptoms like dryness, redness, and fatigue, can all be indications of liver imbalance. This knowledge can be incredibly helpful in diagnosing liver problems before they reach a critical stage. The importance of proactive health care. Listening to your body. The connection between itchy eyes and liver health underscores the importance of paying attention to your body's signals. While minor irritations are common, persistent symptoms that don't seem to have an obvious cause should never be ignored. The liver is an essential organ that works behind the scenes to keep your body functioning at its best. When it starts to struggle, it does not necessarily scream for help in dramatic ways. Instead, it sends quieter, more subtle signals, like itchy eyes, that indicate a need for intervention. If you notice persistent itchy eyes, especially if they are accompanied by other symptoms like fatigue, jaundice, or digestive issues, it's time to take action. Seeking medical advice can help you identify potential liver issues early on, giving you the opportunity to address the problem before it develops into something more serious. Early detection and treatment are key to maintaining good liver health and preventing long-term complications. The importance of early detection. When it comes to inflammatory breast cancer, early detection is one of the most important factors in ensuring effective treatment. The nature of IBC means that the cancer cells spread rapidly through the lymphatic vessels in the skin of the breast, which can cause the cancer to progress quickly. If the disease is caught early, before it has a chance to spread to nearby lymph nodes or other parts of the body, the chances of successful treatment are much higher. Treatment options for IBC often involve a combination of chemotherapy, radiation therapy, and surgery, depending on the stage and severity of the cancer. Without early detection, however, the disease can quickly worsen, leading to more severe symptoms such as the spread of cancer to the lymph nodes or other organs, making treatment more challenging and less effective. If you notice persistent itching, redness, or any other unexplained changes to your breasts, it's crucial not to wait. Your body is trying to tell you something, and the sooner you act, the better the chances are that you can get the treatment you need to combat the disease effectively. What to expect during your doctor's visit. If you experience persistent itching in your breasts, especially if it is accompanied by other symptoms like swelling, redness, or skin changes, it's time to consult with a healthcare professional. your doctor will conduct a thorough evaluation, which typically begins with a detailed medical history and a physical examination of the affected area. They may also recommend imaging tests to gain a clearer picture of the breast tissue. Common tests include mammograms and ultrasounds, which can help identify any abnormalities or signs of cancer. In some cases, further testing may be required, such as a biopsy. A biopsy involves removing a small sample of tissue from the breast to be examined under a microscope. This is the most definitive way to determine whether the tissue is cancerous. While the thought of undergoing these tests can be frightening, remember that it's a critical step in the diagnostic process. The sooner you get the diagnosis, the quicker you can begin treatment, improving your chances of recovery. It is natural to feel apprehensive when facing the possibility of cancer, but keep in mind that early detection is key. If the cause of the itching is not related to something as simple as an allergic reaction or a skin infection, and further testing reveals a more serious condition like inflammatory breast cancer, the earlier you address it, the better the outcomes will be. On the other hand, delaying or ignoring these signs can allow the cancer to spread, making treatment more difficult and potentially leading to more serious health complications. Why you shouldn't wait. The dangers of delayed action. It's all too easy to ignore seemingly minor symptoms, especially when they don't cause significant pain or discomfort. Persistent itching in your breasts might seem like a small inconvenience or an irritation that will resolve itself over time. However, this is not always the case. Inflammatory breast cancer can develop rapidly, and by the time noticeable lumps or more severe symptoms appear, the cancer may have already spread to nearby lymph nodes or other areas of the body. Acting quickly to get a diagnosis and treatment is critical, because the longer you wait, the more time the cancer has to grow and spread. Delayed action can mean the difference between catching the cancer in its early stages, when it is more treatable, and facing more advanced stages, where treatment options become limited, and the prognosis is less optimistic. When it comes to your health, every moment counts. Being proactive. About your health, regular checkups and self-exams. While persistent itching may not always be a sign of breast cancer, it's important to be proactive about your health, especially as you age. As women, it is essential to stay on top of routine breast self-exams, schedule regular mammograms, and attend checkups with your healthcare provider. Breast self-exams can be an easy and effective way to monitor changes in your breast tissue, including any lumps, swelling, or changes in skin texture. If you notice anything unusual, it's important to seek medical advice promptly. In addition to self-exams, routine mammograms are critical for catching breast cancer early, even before symptoms appear. Mammograms are effective in detecting small abnormalities in the breast tissue that may not be noticeable through self-exams. In fact, many breast cancers, including inflammatory breast cancer, can develop without forming a visible lump, which makes routine screenings all the more important. If you have any concerns or notice anything unusual, don't wait for a checkup. Seek medical attention as soon as possible. The power of prevention and vigilance. In the fight against breast cancer, prevention and vigilance are your greatest allies. Early detection through regular checkups and screenings can save lives. While breast cancer, particularly inflammatory breast cancer, is rare, being proactive about your health can ensure that any potential problems are caught early. Itchy breasts, although they may seem insignificant, should never be ignored. They could be a signal that something more serious is going on. By staying informed, listening to your body, and taking immediate action when needed, you give yourself the best chance for a healthy future. Remember, no symptom is too small to investigate. When in doubt, always seek medical advice. Your health is far too important to risk ignoring the warning signs. Taking charge of your health. When it comes to your health, don't wait for something to feel wrong before seeking help. Itchy breasts, persistent changes in breast tissue, or any other unusual symptoms should never be dismissed. These small signals could be your body's way of alerting you to a serious underlying condition. Acting quickly to get a diagnosis can mean the difference between effective treatment and a much more challenging road ahead. By being proactive, staying vigilant, and seeking timely medical attention, you can improve your chances of early detection and successful treatment. Your health is your most precious asset, and taking care of it requires constant attention, no matter how small the symptom may seem. Early detection saves lives, so make sure to listen to your body, take action, and schedule that appointment with your healthcare provider today.